All right. Well, good afternoon, everyone, and welcome to the February 22nd, 2022 update of the provider update. And thanks for joining. Also, I just wanted to say it was super nice to meet a bunch of you at the Family Practice conference this weekend in person. So that was something new. And I think joining us today is, I think Dan is joining us today, Dan Burke, the Bureau Chief for Infectious Disease. So Dan, if you're on, chime in anytime. Amazingly, I don't think we have that many like true updates today. So we'll just get started and with just a general overview, as we usually do. The main things that happened in tracking my timeline here is on 2/17, the New Mexico mask mandate was lifted rather suddenly. And I also just wanted to, I don't know if anyone gets the daily vaccine reporting, but I think it does get picked up, like I think in some of the media boxes, but we're basically going to a weekly reporting just because the numbers are not changing that significantly week to week. So just to save our team a little bit of time, but if it causes any problems for anybody, sometimes we don't know kind of how it's getting used, please reach out and let us know. For community transmission, I think last week I sort of said like, next week it should be just a totally different color, and I was wrong. It is still red. And part of that reason is they do use two metrics for tracking community transmission on the CDC website. One of them is the 7-day percent positivity, which for the whole country here is at 7.54, so has dropped below that important threshold of 10. But the case rate per 100,000 has to be below 100 for any county to get out of the red. So it looks like in New Mexico, we have one, I think that's Harding County, that's in the blue. And I think one of the things that's interesting about the map is it's like kind of going from red to blue in a lot of counties without kind of working their way through orange and yellow. And I think that just is reflective of how quickly cases are dropping across the country, but kind of not there yet is how I feel. I also wanted to just let people know about this website. So BA2 is the variant that is close to Omicron. It's actually about 50 mutations different. I learned recently from Dr. Sosa at UNM. And so I think some people sort of feel like it might be deserving of its own Greek letter, but for today, or for right now, we're still calling it BA2. But this is a forecasting website on the CDC website called Nowcast. In pink here are the proportion of cases that are from BA2, and it's running about 2% to 6% across the country. It gets updated every Tuesday, and this is actually last Tuesday's. I just briefly eyeballed this Tuesday's, and it doesn't actually look like it's changed that much. So this is basically still forecasting somewhat, just because, as we know, like the genomics, sequencing is actually pretty slow. So the like real data on how much BA2 lags quite a bit. So anyway, I've been keeping an eye on this just to, see. I think it's hard to know what to make of BA2. It seems like it's been a big player in parts of Europe. But it remains to be seen, I think, how it will impact the Omicron recovery here in the US. In terms of New Mexico specific data, this is from COVID Act Now, and you can see our cases have absolutely plummeted, which is awesome. But again, we're still in that kind of, fairly high daily cases. And, on the way up, we were feeling like this was a high number of cases. On the way down, obviously, we're breathing a big sigh of relief and feeling like it's so much better than it was. But again, I think, if we give it, hopefully this time next week, it'll be a very different picture, and hopefully even more reassuring than today. The infection rate, the R effective, continues to stay at 6.2, and our test positivity rate has really come down. So all indicators seem to show that, we're really headed in the right direction. This is just daily new hospital admissions by age in New Mexico. And again, a lot of, a lot of the importance of the work we do around COVID, I mean, is to save lives and keep people out of the hospital, but also to keep healthcare systems from being overwhelmed. So I think we are finally starting to see that drop in hospitalizations across all age groups that really, again, hopefully hospitals breathing a sigh of relief, and then all the outpatient work that goes, that there is when hospitals are full. This is our vaccines administered in New Mexico. And again, we just keep headed down on that, sort of in the 20,000 range, unfortunately. This is kind of a new metric we put together, which is just looking at the statewide vaccine progress for people 5+. So this is everyone who's eligible for a vaccine, and just looking at the numbers and percentage of vaccine. Because on our dashboard, we still have been tracking this whole time 18+, which is an amazing vaccine rate, but there's a lot of people who fall outside of that 18+ category. So this is what it looks like if you take everyone who's eligible for a vaccine, 71.5% for people fully masked. So the mask mandate, on February 17th, last Thursday, the governor did put an end to the mandatory indoor mask mandate. There are still some settings in New Mexico that require a mask, and they're listed here. The public transportation is still a federal requirement, and interestingly includes school buses. But otherwise, the public health order, the new public health order, left it open for schools to choose what they wanted to do about masks. So we're seeing a lot of, schools getting messages out. I think PED is going to issue sort of a, some kind of guidance document, perhaps tying masking to case rates. And then just a reminder that they do put this clause in the public health order that nothing in this order shall be construed as prohibiting any business, house of worship, nonprofit, or other from imposing more stringent requirements. So again, I think, part of this move is to say, in the living with COVID, we're all going to have to get used to making decisions about whether to mask or not. I think we really hope for, good common sense around this. And again, there are a lot of settings that right now probably still warrant a mask, but hopefully in a few weeks we'll feel differently. This is, I think we looked at this last week, but I just feel like tuck it away for that time where we might need to talk about masks a lot more, which is just a study that did show that the higher quality masks did have less, provided more protection. And those masks, I think there are still some available that were federally distributed to pharmacies. All right, on to vaccine mandates. There's nothing new. I think we did get a little hint from the CDC that there's not a whole lot of interest in Novavax, so I'm not sure that's going to be on the FDA's radar for talking about anytime soon. Pfizer for TOTS is still on hold. And I think there's also some talk that Moderna will get packaged in some smaller units, and that might be, coming, I don't know, in the next 6 months. So that would certainly be nice. Just to, I know there's some confusion over 4th doses of vaccine. So just wanted to reiterate, and I think people on this call know, but the vaccine for, it's only immune compromised individuals who are approved for 4 doses of vaccine. So that schedule is basically the 2 primary mRNA series doses, then a 3rd primary dose, and that's really how it's getting talked about on the CDC patient-facing website, is that it's a 3-dose primary series, but you can still find that language about an additional dose in other places on the CDC website. But suffice it to say, that's 3 doses that should all match, and then 3 months from the third primary dose would be your booster dose, and that will follow the same. So that will be a fourth dose and follows the same rules for all the other boosters, a half dose Moderna, and you can choose any of the three of them for a mix and match situation. But the mRNAs are in general preferred over J&J, which is phasing out. Other than that, fourth doses are not approved for anyone else. So just the immune compromised individuals. I think this is just, and then there's the special J&J schedule for people who are immune compromised who got a booster, who got J&J. And for that, they're allowed to now get an mRNA like second dose followed by an mRNA booster. For those, I think the big question it revolves around who is moderately or severely immunocompromised. And it is kind of confusing because when you're, I mean, for patients, I think when you're talking about risk for bad outcomes from COVID, you know, that's the whole series of you know, diabetes, hypertension, dialysis, obesity, smoking, and all of those do put people at risk for being, for bad outcomes from COVID. And in some ways, in some other forms, like when we're talking about pneumovax, you know, that group is called sort of relatively immune compromised. But for COVID-related vaccine, it's a very tight list, and this is the list. So, and it is also confusing. You know, I think there's been some confusion. A text did go out to some people who checked immune compromised in the app, and they got a list, or they got a text saying that they might be eligible for that fourth dose. But we do know that people didn't have this list when they first checked the box in the app. So hopefully I haven't just made this way more complicated, but there is fairly tight criteria. There's this little wiggle room in the CDC guidance that says on a case-by-case basis, providers of moderately or severely immunocompromised patients may administer an mRNA COVID vaccine outside of the dosing intervals. And, you know, I think I was actually on the Echo yesterday and one of the doctors posed like, okay, can we start giving a fourth dose to our diabetic patients? That is really not how it's intended. This is still narrowly, you know, following that list of pretty severely, moderately to severely immunocompromised people. So, but, you know, if you need to give it a vaccine a little early, or maybe the person just finished chemo and you make a decision that it's still important to, you know, give someone that fourth dose, you have a little leeway as a provider, but not to be used as a broad sweep for a fourth dose. So on the continuing debate about a fourth dose, and I don't have much to say here except for just it's been in the news, and I think that's also making it kind of confusing on the, you know, on the conversation about immune compromised people getting a fourth dose. This was just an interesting New York Times summary article. This is a picture of a T cell. Basically, this article was talking about a number of studies that have come out. And I think this is good news no matter what happens with the fourth dose, which is just that, you know, it's not all about our antibody levels after vaccine, because we do know, or after boosters, we do know that that antibody level wanes, but that there are some like kind of more lasting impacts of getting a third dose, which is the memory T cells and B cells that will really continue, that are more lasting than maybe just the antibodies. So it's been kind of interesting to follow. Dr. Fauci and the FDA are citing this study, which is also interesting. They had like close to 250,000 patients in emergency rooms and urgent cares, and tracked the number of COVID cases in people who had boosters, and sure enough, like, you know, cases do go up and immunity, at least antibody levels, tend to wane. So I will just wrap up by saying it's, you know, clear as mud. I think there does seem to be some hints out there that in the fall we might be looking at another booster or a fourth dose, but that is not something that anyone at the CDC has said to us. And there seems to be healthy debate on both sides of the question on how worth it is to go down that road of a fourth dose. And then this is just New Mexico specific data I thought was really interesting on the topic of boosters and breakthrough cases. So basically, the blue lines are fully vaccinated without, so breakthrough cases in people who are fully vaccinated. And then the orange is breakthrough cases in people fully vaccinated with a booster. So you can definitely see Omicron. This is the Omicron timeframe here really hit, and as we all know, many people still had breakthrough fully vaccinated with boosters. This is just cases. It does not talk about how, whether people were hospitalized. And then these ones I think we went through last time, just people vaccinated outside of the US with a WHO approved but non-FDA approved vaccine. You can basically pick up where they left off and use Moderna or Pfizer for that. And then follow the usual schedule that you would if they had started with Moderna or Pfizer. And then just a reminder that there's no longer a waiting period after monoclonal antibody. In case I didn't share this last time, our amazing immunization team has gotten all the guidance onto one sheet and has kind of used this model that we originally got from Texas and updated it as we went along. So we have it as a PDF if that's something you're interested in. And then on the therapeutics, really the update is just that there is kind of a revamp to the website that should help, especially patients looking for therapeutics, which is basically that it is, that it's basically zip code driven, and then you can also choose which therapeutic you're looking for, and it will tell you where it's available. So it may also be helpful for providers searching. Definitely, Paxlovid, there's a new study out about its efficacy, and it held up incredibly well with very few, really relatively few side effects. It is a lot of medicine, a lot of pills, which may be a turnoff, but again, really important to get that started early on in the course within 5 days of symptom onset. And we have heard from people that, they've been given the advice, give it a few days and see how you feel. But if you look at the studies, like definitely hospitalization and death just kind of continue to happen to people 10 days out. So you can't always predict. If you have a high risk patient, it's better to move early, get the medication prescribed, than to kind of take a wait and see approach. And then just a plug for Evusheld, which is the PrEP medication, so pre-exposure prophylaxis. It's a monoclonal antibody, 2 different ones combined, so 2 IM shots. It's long-acting, should provide protection for 6 months, not a substitute for vaccine. If it's not right now, like at first when it came to the New Mexico, we did have it limited to specialists who worked with people with immune compromise, were the ones who could prescribe it, but that will be opening up so anyone can prescribe it. I think, as primary care docs, we are often taking care of patients, doing the bridging care between rheumatology visits, and probably in a really good position to recommend this medication for high-risk patients. But again, following that very strict list of who's immunocompromised. The bebtelovimab, which is the new monoclonal antibody, and again, the one that had a study that wasn't really powered to show whether it saved lives or prevented hospitalizations, but probably does. But as a result, we kind of put it as a 3rd-tier medication, but that should be arriving in New Mexico. It was shown to have efficacy against the more recent variants. There's no more OMAS, so anyone can prescribe any medication for any patient as long as they're positive for COVID. Evusheld, you shouldn't be positive for COVID. That's the only exception. And one last thing, which, and Dan may be in a better position to talk about, but Better Together is a program of mini grants. So if you work with community orgs who are interested in working on vaccine hesitancy in communities, there is grant money available, and they can go to the Better Together New Mexico website, which also has some nice resources. But here are the resources specific to the grant at this link here. Here's a little more information about the grant cycles open now, closes March 31st. Organizations are eligible to apply for up to $200,000 to be used through June 2024. And this may be work that a lot of people are doing, and it would be nice to have some money to continue to fund it. And I think that is it for me today. Great, thank you. Dan, do you have anything that?
I think you've covered things, pretty well. I really like that article on, how much depth of immune protection we're getting from even the 2 vaccines, but certainly with the 3 vaccines. And there was another one I was trying to get my finger on, which says with a booster with 3 shots, we're basically down to 1 death in a million risk rate. So it's incredibly effective, and it's starting to look like it's going to be longer term. And I just had one little thing that I had confirmed around immune suppression with the CDC, and what I asked was, if you get the shots and then you get, say, chemotherapy, and now you're immune compromised, do you need to go back and get that 4th shot? The answer was no. You got it while your immune system was up to par, and you're good there. So that's just a little detail, but some might find it interesting. That's all I got. And Audrey looks like she's on as well, Audrey Herrera Castillo. So she's the head person with Better Together. So the window is open on that. So
that is awesome, and feel free to pipe in. I'm not the best messenger on that one.
No, I think you did perfect. And I put my name in the chat. And if anyone has any questions about this grant program, it's open through the end of March. And we ask that while your organization may or may not be interested or eligible to apply, if you know anyone in your networks who could benefit from some outreach efforts, the goal is really to get vaccine to areas around New Mexico that haven't had it. It might be about misinformation, disinformation, and actual vaccine access. So any of that qualifies, feel free to pass along this information, and my email is in the chat.
Great. All right, so let's go to the chat quick. If anyone has questions, please feel free to pipe in. And so again, on the 4th dose, so some people might hear from patients about being texted about a 4th dose. And again, that group are people who checked that they were immunocompromised in the RTS app. But again, the RTS app does not ask for kind of super detailed information. It's just your impression of whether you're immune compromised or not. And the text does say, our records show that you're immune compromised. If this is so, or something like that, then you might qualify for a 4th dose. But I think people very quickly and again, the timing was probably bad just because there's been so much talk about a generalized 4th dose in the media. And I think people very quickly went to a 4th dose has been approved in New Mexico, but not the case. And the CDC hasn't given license on the 4th dose for anyone except for immune compromised people who fall into those fairly narrow categories. Having said that, we are not asking for any proof. You don't need a doctor's note or a prescription. So we're taking people at their word, but people shouldn't be showing up just saying, I get 2 sinus infections a year and I feel like my immune system doesn't work that well and I need a 4th dose. But really those people shouldn't have gotten that third additional dose. They should have just gotten the regular booster dose. But, it is getting to be a more complicated conversation with people. So anyway, I hope, so sorry for any confusion. We did put a stop to any further text going out about that. It was really meant to just kind of give people a nudge to get signed up for a 4th dose, but just realizing that it probably isn't the right approach. So so that is where we are with that. And just to say that people have been eligible, immune compromised people have been eligible for that 4th dose since about January 13th would have been the first time someone would have qualified for that dose. So it's kind of been around, but we have noticed we don't have a big uptake on it. So we were thinking that might be a good idea, but it didn't turn out that it was.
And Miranda, I could go ahead and read you a couple questions just
Okay.
just to relieve you from doing all of it. So one question is caretakers of immunocompromised individuals, any 4th doses on that one? And I don't think so. And then for an immune compromised person who received 2 doses of Moderna, then a 3rd dose of Pfizer or vice versa, what should the 4th dose be? Does it even matter?
I think you could go with anyone on that. Yeah.
Pretty interchangeable, right? At this point, the mRNA doses.
Yeah. I mean, it doesn't seem like CDC has given up on the primary series being, they want those 2 doses to match, but we still know that there are people who it doesn't match, in which case you just pick whichever one you want to continue with. And in some ways, Pfizer seems less confusing because you don't have to deal with the 2 different doses depending on where you are in the series.
Good point. Question here on patient taking biological agents that the biologics that suppress the immune system, are they considered immunocompromised?
Yes, they are.
Okay. Good. Not good, but good to know.
And just to circle back to the caregivers of immune compromised, I think this is, again, it's not that isn't a high risk situation, but I think we're really trying to separate high risk from someone whose body isn't going to respond to the vaccine. So you would expect a healthy caregiver of someone who's immune compromised, who's gotten vaccinated, to have responded well to that vaccine. But then, again, absolutely, since we know nothing's 100%, that person should consider masking and, probably mostly masking, but just being really careful about trying not to get exposed to COVID. But at least right now, there's not a lot of data that a 4th dose would even do that much more on top of, in a healthy individual on top of the 3 doses that they got.
Yeah. And we've got a question here. Well, not a question, kind of a statement that many of this person's immunocompromised patients are not coming because they really didn't know they qualified. So on the one hand, we might have overshot it with the texting, but I think that the underlying problem that we're trying to address is still there, is that some immune compromised folks don't know they could benefit from that 4th dose. And that is in fact, and I think that's where really our providers are the one that we're counting on. Who you're, I'm sorry, stealing your line there.
No.
But that, who your immune compromised folks are, and if there's ways to reach out to those people and just let them know they might benefit. Back to you, Miranda. I think that's what we would say.
No, I'm just laughing because that's exactly like, tried it this one way, realizing, again, like I said, there's a lot of this that is, I think, it is time to move back to good patient-centered care rather than trying to get, care through text message. Although, it's nice to have that tool as well. And I think, I mean, we have been sort of brainstorming some other options. Would love to hear from anyone here on ideas. I mean, we did wonder if the FQHCs that, might have lists of patients on some of these expensive biologics, might be able to provide some more targeted messaging. I don't know if that's possible or not, but kind of thinking along those lines. And or like having the call center do some outreach where they could really screen people and provide guidance rather than just, texting.
Right. And one person's asking here now, if they do determine somebody's immunocompromised, they've had their full series, two and third, the booster. What type of Moderna dose would they get? Would that be the full dose, or what would that be for the fourth dose?
Okay, sorry, give me that scenario again. They've gotten their primary series.
They've gotten their primary, they've gotten their booster, and they come in saying, hey, I'm immune compromised. The provider looks at it, says, yes, indeed, you qualify for being immune compromised. So now what are they going to get if they're going to go with Moderna?
Okay, so we actually had to go to the CDC to ask this question. So if you got your primary series and then the patient got a half dose Moderna booster when they really should have gotten a full dose, third additional dose. So basically the CDC said, consider that one a mistake, the half dose, and just start with a full dose and then go to a booster, what's now 3 months later. So just kind of skip that dose. If you do discover it in a very timely way, like let's say you give the half dose booster and then look down and go, oh, shoot, you're immune compromised, you should have had a whole dose. You can correct that mistake by giving another half in the other side right away. And so 2 halves make a whole. But as time elapses, and they didn't give us a very specific time frame, but I kind of feel like if it's there in clinic and you catch it, do it. Otherwise, anytime after that, just and it may not be your mistake. I mean, it might, or not even really, I shouldn't use the word mistake, but even if they're coming to you and said, oh, I got a half dose somewhere else, just go ahead and give them the full dose. That's the third additional dose. And then 3 months later now, they would get the booster, which would again be the half dose.
Tricky. Okay.
And Karen, do you have your hand up?
Sorry, I do. I just have to unmute. I was going to turn my video on too. I asked this. Sorry? I am.
Fading in and out.
Okay.
Maybe she'll chat.
Come back around to that. The other question is, did we get any of these textings out to 5 to 11-year-olds who, have immune compromised situations? And
So I don't think so, because I think these were really people, it was targeting the fourth dose, and at least for 5 to 11-year-olds right now, that third additional dose is approved, but a booster is not approved for them. So they're really still at 3 doses, and we're kind of waiting. I imagine that whenever boosters get approved for the general population of 5 to 11-year-olds, it'll also get approved for this immune compromised group. That's sort of how it's been for the last age group. But we're still waiting on that, what seems inevitable, but hasn't happened yet.
okay. And then we got a question about updating the investigation and contact tracing guidelines for New Mexico. I'm not aware of that going on at all. I don't know if anybody at EPI's on.
Yeah, Olinka, if you're on, do you want to unmute and tell us a little bit more about that?
Can you hear me?
Yeah.
Hi, sorry. I just wanted to know if there was any updates, because I think there was a couple of calls back that it was announced there would be updates on case investigations and contact tracing, just because with the mandate for the masks being lowered and, you know, among Omicron surges going, I just wanted to see if there was any updates in regards to the case investigation, submitting the case report forms. This might be more of a question for Epi, so I could email them.
Yeah, I think that none that I know of, but it is a good question for Epi, and whatever you learn, let us know next week. Although let me backtrack that comment, because I'm not sure that we have anything really pending, and I was thinking maybe next week we would break. But I mean, there's always surprises, but it didn't seem like there was going to be anything new. But yeah, or you email me, we can email out to the group.
Okay, we got a couple more follow-up questions on the 5 to 11-year-olds. So let's just clarify, they are getting the 3rd dose, but not the 4th dose at this time, right?
If they're immune compromised, I always keep
Yes.
yeah, but not a general recommendation for 3rd or booster doses for 5 to 11-year-olds.
Hope that helped, but I don't know that we're from the state communicating that at this point. So I think if you're a provider with those kids, I would be reaching out to them from your office. All right. Okay, so we're for individuals with immunocompromised that end up getting a total of 5 shots. Is there any recommended way to fit it on the CDC card, which only has 4 rows?
Great question. Yeah, those CDC cards, I mean, 1, don't fit in most wallets, and 2, it is just funny at the beginning. I mean, myself included, like sticking stickers on there, and one site had these lovely round stickers I really liked that stuck on, but then, you know, as soon as there was a booster, you realize like that really wasn't a good idea. So yeah, we don't know of any updates. I think, you know, for most, it is nice to have a full record. And again, you know, you can print out of NMSIS what looks like a vaccine card. I should double check that you can have all your 5 doses print. But I think in terms of like entrance to most events, you know, not too many places are, you know, as long as you have 2 doses and are fully vaccinated, that's usually your ticket in. But it is a good point, and we can ask when we meet with the CDC just what their thoughts are about that.
Hi, this is Karen, and I had a glitch with my audio, so I wonder if I could ask my question now. I'm sorry.
Absolutely, absolutely.
I was just wondering that those nice, simple kind of posters about treatment that can go out to patients. Is there a site where we can get PDFs for those? Thank you.
Are you talking about the one, I think I showed it last week, that are like really a simple, like the 4 medications for patients?
Yes, exactly, in Spanish and English.
Yeah, I can definitely send you the PDFs of those. Because the bebtelovimab had not made it on there, it's still getting updated, but you know, it may be sort of good enough to get the message out that there are these 4 other medications. And then if people make it to an infusion center, discuss the options there. But I think the biggest message is just the oral medications for patients to, or what we would like to see is patients more aware about the choice of oral medications. So yes, I will send you the PDF, or I'll just send it to this group.
Thank you.
Oh, and then sure, if you are able to upload them to the chat, that would be awesome. And I can send them out. Great. Are there any other questions? All right. Thank you, Ben. And any last words, Dan? Or
No, I think just, you know, we are in the long run here for the vaccinations and, you know, and probably testing. I mean, things are coming down closer to earth here, but I think there's still going to be continuous efforts going forward and, you know, hopefully a lot less crazy than they've been. Hopefully that's the way it'll go, but keep hanging in there. We're gonna be doing this for a little while still.
yeah. And Chris Schroeder, any updates from your side?
Hey, Dr. Drew. Oh. 1,000 apologies. Can you guys hear me here? I've got a new mic on order, so hopefully this will be fixed. There will be some app updates to announce on Thursday, so keep an eye out for those. And just, you know, always ending with gratitude for all the stuff that you guys are doing and working so hard to keep your community safe. So thank you. Keep up the great work. And if we can help out in any way, please reach out.
Agreed. Thank you again, everyone, so much. And I think maybe just to, how about we'll sort of assess on Monday if there's updates and then send out a reminder or a cancellation for this meeting. But we really appreciate that you're willing to spend your lunchtime with us every Tuesday. Appreciate your feedback, and please feel free to reach out if you have ideas and thoughts about, you know, any of this that we're discussing. And again, thank you so much.
Bye-bye, everybody.
All right. Bye-bye.
Thank you.